It's a simple fact. As our years advance, our hearing often declines. But thanks to the skilled audiologists at the Hearing and Speech Agency, there is no need to live in silence.
For most individuals, historically, they would start to lose their hearing as they aged more closer to 70. But now with baby boomers, we're starting to see hearing loss develop at a much younger age. We started out as an agency that was geared towards helping people with hearing needs. We've developed into more of a full agency that services people with a broad range of communication challenges. We serve individuals ranging from newborns all the way up to the elderly.
First, I'm going to take a look in your ears.
The role of the audiologist here at HASA is to work with patients who come in with a complaint of hearing loss. So from start to finish, we do a comprehensive evaluation. We check their hearing, and if there's a problem, we will either refer out to an ENT or physician for a medical evaluation, or if we determine that there's a need for hearing aids, then we'll work with them through the hearing aid process. We talk to everybody, especially if we see an indicator that a hearing loss was a result of noise exposure. We certainly talk to parents of young children and teenagers to try and help them preserve their hearing. Some of the warning signs of hearing loss would be certainly if you're having difficulty hearing conversation, but if you're also having difficulty hearing voices over the telephone or understanding voices that are coming out of your television or hearing what you're seeing in a theater production, then certainly that would be an indicator that there's something going on with your hearing. Some of the first indicators of hearing loss that someone might experience would be difficulty hearing women's and children's voices, so higher pitched voices in conversation. We usually recommend that someone first schedule an appointment with an audiologist, and they are licensed to not only program and dispense hearing aids, but also diagnose hearing healthcare matters.
This is an older hearing aid that used to be used pretty regularly to address people with hearing loss. And this is an example of a current hearing aid. This current hearing aid is appropriate for most degrees of hearing loss. This is an example of a pair of hearing aids that we might fit on a person today. Besides them being a very small size, they're discreet. They also communicate with one another. So they assess your auditory environment and they make adjustments based on that in order to help you hear better. You're also able to have multiple settings or programs within the hearing aids, so they operate differently when you're in a quiet environment, for example, compared to when you might be in a noisy environment. If there's someone who likes to watch television at home, they can get something like this that you're actually able to connect into the back of your television, and then the sound from your television can be streamed directly to your hearing aids. Also, people who are watching the television who are not wearing hearing aids are able to adjust the volume to their preferred volume as well. Another option would be something like this small mini mic. So this works great for listening to people in speaking environments, whether it be a restaurant or even a lecture. Another option would be to have a small device that actually sits down in the ear canal. So one of the nice things about current hearing aids are that you're actually able to use your cell phone as a remote control. So you're able to adjust volume on your cell phone. You're also able to adjust how your hearing aids are working in different environments. You're also able to use specific settings in a specific environment. For example, if you walk into a restaurant and you use your cell phone to make adjustments on your hearing aids, you can actually save those settings, and the next time you go to the same place, your hearing aids will automatically reset to your preferred settings. If you were to accidentally misplace your hearing aid, you could actually bring up the app on your phone and locate the last place that the hearing aid was working. On average, you have to change a battery about once a week or so. But with the new rechargeable systems, when you take the hearing aids out of your ears, you place them in your charger, and then overnight, usually in about 3 to 6 hours, depending on the device, they come to a full charge, and then you're able to wear them all day again.
It usually takes about 2 weeks till the time that they're fitted with the hearing aids. At the day of the fitting, and the first thing that we do is we program the hearing aids, and we use the individual's hearing test results in order to program the hearing aids to determine where the hearing aids need to be set. With the user, we'll put the hearing aids on their ears. We'll do some testing. It's called real ear measurement, and then that tells us whether or not the hearing aids are set appropriately according to what that individual needs. And we make fine-tuning adjustments using the computer software so that the hearing aids are set to sound natural. Before we let anyone leave our office, we make sure that they know how to use the hearing aids, how to insert them in their ears, how to change the batteries, how to use the different program options if they have a volume control or a program switch. We often encourage them to live their life as they would ordinarily. We want them to take notes, so when they're wearing the hearing aids, we want them to record times when the hearing aids sound really great, times when the hearing aids don't sound great. We always request that they schedule a 2-week follow-up visit. If we need to address any changes, we'll address it at that time. Audiologists, we are also trained to repair hearing aids. Let us test your hearing, check to see where your hearing levels are. If we do determine that you need a hearing aid, start that process. Then once we get those hearing aids on and they're programmed, it really does help them preserve quality of life. It gives them back access to sounds that they were missing, and they really do recognize the benefit once they get there.
Medicare will cover the cost of your annual hearing test. You'll just need a referral from your physician. If you want additional information on hearing aids, including payment options, or to schedule an appointment with an audiologist, call the Hearing and Speech Agency at 410-318-6780 or visit their website at hasa.org.